Wow, what a wonderful day. Thank you, School Alerts.in and its jury for this opportunity. I am Sahana Senthil Kumar, a student of St. Vincent Paloti School, and my pronouns are she, her, and hers. For the next 7 minutes, I will be talking on my way of handling the wave 2 and 3 as a leader of my country. How many of you are aware that the sanitary and hygiene practices enforced today were been a part of our Indian tradition? Please do raise your hands. Well, that's fabulous. I am going to take you to the roots with a known but forgotten story. I have been told by my grandparents that in the past, bathrooms and toilets were outside the house. Footwear were never allowed inside. People entering the house are expected to wash their hands, feet, and face thoroughly. Mandatory 10 to 15 days of isolation is required when there's a birth or death in the family. The Western influences and modernizations have turned these as orthodox and have been taken away from being practiced. These practices were once laughed at and insulted as stupid practices come to our rescue now in the form of wearing your mask, washing your hands, social distancing, quarantine, self-hygiene, etc. etc. These are classic examples of how our ancestors were hygiene conscious and how superior their infection control and sanitization practices were. As a leader, my first step would be to reinforce and bring our ancestral practices back into use by educating people and making it a mandatory education in school to create cultural bindings. As in Japan, school kids are taught similar things which make them a responsible citizen. We successfully overcame the first wave by enforcing strict hygiene practices and quarantine measures. Inter-country, state and district movements were restricted with lockdowns and coupled with relaxations. This would have been continued when there is a need. We celebrated our victory over the first wave despite knowing the seriousness of the second wave and its impact in countries like Brazil, England, and Germany. With early indications like these, I would have triggered people's safety as priority number one and postponed election rallies, sports events, religious events, public gatherings, which poses a high rate of risk to people. Groceries, goods, and rations would have been channelized with the help of IT and delivery infrastructure, which already existed with e-tailers. Protocols such as staffing, social distancing, and self-hygiene would have been enforced to keep growth and economic situations stable. With early indications and insights from Brazil, England, and Germany over the second wave, using our IT gens, TCS, Infosys, and Wipro, a statistical modeling based on the learnings of the past, other countries, and different sources would have been created. This would have assessed the severity of the pandemic and helped them classify into best, worst, moderate case scenarios and plan to handle each of these situations would have been drafted. Task force with the help of expert panel members, subject matter expertise, and volunteers would have been created, and they would have been trained to maintain law and order, governance of the situation, monitoring, vaccination, etc. This would have had a ready-made task force available handy in a ready-to-deploy state. India was the forerunner for developing a vaccine to contain the spread of the virus. Covishield and Covaxin, the homegrown vaccinations, would have been prioritized for the use of our country people before we export it out. Post-clinical trials and vaccination for the frontline workers. People would have been vaccinated at a free rate without any restrictions vaccination, people would have been provided with essential goods at a subsidized cost would have been announced and implemented. When there is an excess load on public healthcare systems, provisions to declare state of emergency and bring all the private hospitals into the direct control of health ministry would have been made. People would have been provided services with the help of private hospitals at a government defined rate. Protocols such as classification of patients based on the severity and how to treat them would have been drafted. This would have maintained a demand or need of oxygen cylinders and ventilators. All political party meetings would have been conducted, keeping all the political indifferences and agendas aside. Priority on decision to create medical infrastructure using government fund would have been implemented, keeping a hold on all other non-developmental activity spendings. Programs for rehabilitation of recovered patients and ways and means to help families who have lost their sole breadwinners and livelihoods by a financial package would have been distributed. Last but not the least, I, along with all my ministers, would have been tasked and empowered to work on the ground to assess the situation and help people who are in need. This would have created confidence within our people and re-emphasized that everyone is in the support of our fight against COVID 19. We all are in it to win it. Thank you. Jai Hind.